Today, I want to talk about bladder stones in the dog. Bladder stones in dogs is incredibly common. My name is Dan, I'm a veterinarian, and I'm going to break this down for you. Today, I'm going to go over what you might notice at home, how the veterinarian diagnoses it, and guys, how we're going to treat it. Bladder stones in dogs are incredibly common, and some dog breeds like Schnauzers are overrepresented. What you may notice at home is repeat UTIs, or urinary tract infections. UTIs are one of those things where a dog may go pee more often, they may pee in abnormal locations, and you may even notice some blood in the pee as well. UTIs, guys, are a nuisance, and when you treat them with antibiotics after being diagnosed, they should go away. Very rarely should they become chronic or happen over and over again. If you have UTIs that keep happening, I would start thinking, do I have an underlying problem like a bladder stone? The next step is going to the veterinarian office and getting it diagnosed. A veterinarian will do a cystocentesis. They take a needle and they put it into the urinary bladder through the skin on the abdomen, and they get a urine sample. Most veterinarians will use an ultrasound to guide it. This is common practice and is expected. When a veterinarian draws the urine back, they can then test it for a bladder infection, protein, crystals, all kinds of stuff in the urinalysis test. As well, when they do the ultrasound to guide the needle in, they can definitely see things that are abnormal, like a thickened bladder wall or even stones in the bladder. You can kind of see it kind of like glowing. You can see kind of lumps and bumps from the ultrasound, and it's pretty obvious in most cases. If a veterinarian needs a little bit more help or just double checking how many or give them a better idea of the severity of it, they can also do an x-ray. I almost always do an x-ray because I want to make sure I know exactly what's going on. Also, I want to make sure that there's no stones in the ureters, the kidneys, the urethra. We just need to check everything. Imaging is really how you're going to diagnose the stones. Once you have the stones diagnosed, you're going to go do surgery in most cases. Once you get diagnosed, the veterinarian is going to do surgery. It's pretty straightforward. They make an incision just over the bladder when the doggy is on their back, and they cut into the belly. They expose the bladder, cut into the bladder, and they pick out all the stones. They flush the urethra to make sure there's no stones in the urethra where the dog goes pee. And once they got all the stones out, they flush the entire bladder, and they usually get a sample for culturing. Once they do that, they send a stone off to be analyzed, usually at the University of Minnesota. The stones are analyzed, and they tell us how to prevent regrowth. If it's like a calcium oxalate or a struvite or whatever, there's different rules on what to do to keep the stones away. Once the veterinarian does all this, they will give you a game plan to help prevent future bladder infections from stones. And their plan will help you to prevent stone regrowth. I've had cases where people don't follow the plan. They don't do the supplement, they don't do the food, and they fall off the plan, and that leads to stone reformation. Unfortunately, I've had situations we had to go in multiple times because of failure to comply with diet and supplement requirements. Remember, guys, the stone's formed for a reason. And if we change the diet and supplements and we adjust the pH and make the bladder a more healthy environment, we're less likely to get stones in the future. Here's the deal. In some situations, a veterinarian may do food or do a handful of things to help dissolve or reduce the stones. They're really small if they feel like they can get them peed out. But in most cases, we're doing surgery and we're diagnosing the stones, and then we're going to treat long-term to prevent stone reformation. Bladder stones are incredibly common. A lot of times, guys, veterinarians, because using ultrasound, are diagnosing them right away. But if you get repeat urinary tract infections, you should be looking for stones because it's a high likelihood you may have a bladder stone. Hi, everyone. My name is Dan, I'm a veterinarian. Thanks for watching. I really appreciate you guys. You guys take care.